Hello to all. I am Vishnu. So today I am going to start with the migraine headache series. So actually we have three types of headache. One means mainly which we talk in medical terms. One is migraine headache, which is the most common. Then we have tension headache, which is more or less common. And then we have cluster headaches. So first we'll talk about migraine headaches. This is going to be a very long presentation. And this presentation has been made with a therapeutics perspective. So therapeutics means, you know very well, this is actually a fourth year PharmD therapeutics topic and a PharmD PB first year therapeutics topic. And otherwise also any medical professional, it need not be just a PharmD, any medical professional who are interested in learning, who are interested in practical knowledge, who are interested in enhancing the horizon of their knowledge can definitely be a part of this presentation and learn a lot of things. And I hope I'll be of service to you. This presentation is going to be very long. So I'll be dividing it into maybe 2 to 3 or maybe 4 sections. Today I'm going to talk about what is migraine headache, what are the risk factors, what are the pathophysiological theories, what are the symptoms, and how do we diagnose it. Then we will talk about the treatment strategies, home remedies, that is patient counseling, etc., etc. We'll go into that. So that's how my plan is. And in between, actually, I had started a mnemonic series also, which in that I have talked about two videos. So I will be continuing that once this migraine headache is over. So that's how the plans are. So let's directly go into migraine headaches. This is a common recurrent primary headache of moderate to severe intensity that interferes with normal functioning and is associated with gastrointestinal, neurologic, and autonomic symptoms. Common means I already told you migraine, most of the people around the world we usually see some or the other person, every alternate person talking about having at least a short episode of migraine in their day-to-day lives. Recurrent means something that comes repeatedly. So migraine is not something that is a single episode. The single episode usually is a headache, but then if it is manifested into a lot of other symptoms, we call it as migraine. It is a primary headache of moderate to severe intensity. Actually, we have mild headaches also, but usually when we talk about migraine, we usually say it in the moderate to severe perspective. That interferes with normal function, especially you know very well. If you are listening to this and you had a very severe headache anytime in your life, you know very well what will be your mental state of mind and what will be your physical state of mind. If you are a student and you are having migraine, you know very well how much you will be able to learn. If you are a working professional and you are suffering from migraine headache, you know very well how much you will be committed to your job. Even if you are not doing any of those, you are a geriatric or an old age person, or you are just a person who is sitting in the house and you are getting a migraine headache attack, you know very well how it interferes with your day-to-day life activities, your psychological status. Because people with migraine, when they get an attack, they become very irritated. They don't feel like doing anything. They just want to somehow crouch themselves in the bed. They feel so horrible because migraine is horrible. It is associated with gastrointestinal, neurological, and autonomic symptoms because it depends on which part of the head it is affected. And also it has some effect on the autonomic nervous system, which interferes with your gastrointestinal system. And also it interferes with your hypothalamus. So that's why you will have some other symptoms as well. If we look at the etiology, see, always remember there are many people who ask me what is the difference between etiology and risk factors. I personally believe that there is no difference between the etiology and risk factors because, for example, if consumption of fatty food or junk food, if it is a risk factor for hyperlipidemia, then we can say it as an etiology for dyslipidemia also. So I personally believe that even if you study the risk factors, even if you study the etiology, both are absolutely the same. So let's talk about the etiological factor. So first is genetic predisposition. Let me tell you one thing right now. Most probably I'll be saying it in future slides. See, I made this presentation when I was a teacher. I used to teach at a college. I was an assistant professor there. So that time when I used to teach students, there were a lot of things which used to coincide. Like for example, if I am teaching depression and I'm talking about SSRI, and the same SSRI comes in the treatment of some other disorder, I will not be explaining the same thing to them again because I'll ask them to refer what I said in depression. So that's why in this presentation also, you will find many areas where I have written refer. Obviously you don't know what to refer, so I will be explaining that to you. Just wanted to make it clear why I have written refer in most of my slides. So genetic predisposition, always remember if your parents or if your first degree relatives have a history of migraine headache, or if they are currently suffering from migraine headache due to any causes, then the chances of you getting the same problem is also a very high percentage. So there will be a high risk of you getting the same condition as well. There are certain food that can actually trigger migraine headaches. Actually, I had that once in my life. So that time I was actually advised to avoid chocolates because they actually, stimulate the brain, and overstimulation of the brain can also result in headache. So there are certain food triggers that can actually, cause migraine headache. First is alcohol. Alcohol, because it is a CNS depressant. Although it is a CNS depressant, but when after an alcoholic consumption, depends on your sleep pattern. Even if you slept very well and you got up on the next day also, if you are a person who has a history of migraine, you may get headache as a hangover reaction. So alcohol can induce headaches as well. Then we come to caffeine. Caffeine is a very powerful CNS stimulant. So that is why you should stay away from black coffee if you are suffering from migraine headaches, because black coffee means it is a very powerful reservoir of caffeine. Caffeine will be in high concentration. So that can be a risk factor. Chocolate, not exactly all types of chocolate. Most of the chocolates that we think which we eat and which are shown in the advertisement as very healthy and all these things, they actually are not. If you look at the backside of most of the chocolates and see the nutritional value which has been written there, you will be surprised. And most probably most of you know very well that chocolate is not a nutritional substance. It is just something to give pleasure to your taste buds. But there are certain kinds of chocolates which actually is good as a part of your breakfast, and it is also good for your memory enhancement. For example, dark chocolate. Dark chocolate means the concentration of cocoa will be higher. To some extent, it has been found that caffeine may be there, but even then, dark chocolate actually, stimulates the brain a lot. So that can actually trigger migraine headaches, especially in a person if he or she already had a history of the same. MSG. MSG means monosodium glutamate. So monosodium glutamate is just like a flavoring agent. It is usually found in many food substances. For example, the noodles that you eat, many food substances or in flavoring agents, you will find MSG. So this MSG also triggers migraine headaches. And then we have saccharin. Saccharin, it is a artificial sweetener. So that can also trigger migraine. There may be other foods as well. I'll keep on referring because this presentation will not end today. So later, if I find some interesting info about other foods and their mechanisms, how they cause headache, I'll be very happy to share it. Then we come to environmental triggers. High altitude, because the higher the altitude, the lower the oxygen. So that is not good for the brain. That can trigger headaches in a person who already has a history of headaches. Flickering lights. Always remember, flickering lights can cause two types of problems. Number 1, seizures or epilepsy. Number 2, headaches. Flickering lights, see, always remember whenever you are seeing a flickering light, which is getting on or off, or which is showing multicolored and very bright, means it becomes alternative. That has an effect on the brain. The neuronal discharge, the neurotransmission keeps on becoming rapid and rapid. And that is why if you look at some articles or literatures or even in some websites, flickering lights are actually not advisable for patients who are suffering from headaches and seizures as well. Anyways, I'll talk about, there is a big presentation on epilepsy that I would like to share with you. So that time I'll be talking about all this. Obviously, loud noises will also trigger headache. I don't need to explain that to you. You know, somewhere it will make you irritable as well. And smoking can also trigger headache because smoking means nicotine. Nicotine is a very powerful vasoconstrictor, and also it is a very powerful CNS stimulant. So we don't need to say anything. Psychological or physiological triggers. So fatigue, obviously, for example, this is usually applicable to many pharmacists and many medical professionals, whether it is a nurse, whether it's a doctor, whether it's a security, or anybody who are working in alternate shifts. For them, this thing is very common because their circadian rhythm or biological clock keeps on changing. Most of them are not able to get adjusted to it very fast. So that results in fatigue. And definitely fatigue means your brain is getting tired and tired. That time, if you are engaging yourself in any kind of exhaustive activity or any kind of activity which requires brain coordination, mental coordination, that can trigger headaches because already the brain is tired. It needs rest for a long period and you are putting extra burden on it. Lack of proper sleep, as I said, in night shifts and all these things, this may happen, especially in jet lag also, especially from one country you're going to another country, and time zone changes. That can also result in headache for few days. After that, you get back to normal. Lack of proper sleep, it can be like insomnia, or maybe it can insomnia, as I explained in my video on sleep-wake disorders. You can refer that. Insomnia is of two types. One type of insomnia is that in which you are lying on the bed, but you are not getting sleep. And that is why there we use fast-acting benzodiazepines because they trigger your sleep very fast. Another type of insomnia is that you are getting sleep, but in between of your sleep, you are getting up many times. That means maintenance is not there. So there we use long-acting benzodiazepines so that the sleep is maintained. So if you are suffering from insomnia, and then obviously the next day you get up, if you are a student, you have to go to college or school, or you have to study for your exams. Or if you are a working professional and you have to be on duty the next day, depending on the complexity of your duty, that can trigger headache in you. And definitely stress. Stress means there is a hormone known as cortisol. So cortisol is also known as the stress hormone. If you are suffering from any kind of stress or depression, always remember depression leads to anxiety. No matter how much we talk about it, depression somewhere or the other leads to anxiety. Because today, if you are sad about something, you may think, and if there is no solution to that, tomorrow you may be anxious that the same thing may haunt you again. And that is why many depressive patients end up becoming suffering or becoming victims of anxiety disorders. And that is why SSRIs are used in both depression and in anxiety disorders. So if you are suffering from stress, definitely you will be insomniac, you will be overthinking. Stress means overthinking, so that can also lead to unnecessary headaches. Menstruation, this is very, very important. There is always an element, I have told this many times, but I still, anybody who is watching this for the first time, so I would like to tell it again. There is a element which is known as magnesium. And this magnesium is very important to reduce premenstrual cramps, the mood changes associated with premenstrual syndrome, and especially the headaches associated with premenstrual syndrome. especially during the periods also, if you are suffering from all this, magnesium is very good for that. So that is why if you are eating a diet which is rich in magnesium, it is good. So if you are a female of childbearing age means you will be in, menarche. And if you have magnesium deficiency, so this I'll tell it to you once again. If you are a female of childbearing age, and if you have magnesium deficiency, that can trigger headaches when you get your periods. The reason is magnesium helps to relax the brain and reduce the risk of headaches, either as a part of premenstrual syndrome or during the menstruation. So please make sure that if you are suffering from headaches, recurrent headaches during the periods, then definitely have a diet which is rich in magnesium, that is green leafy vegetables or something like that. Or if it is very severe, then you may take magnesium supplements under the advice of a physician or any healthcare professional. Okay, now we'll look at the pathophysiology. So these are actually some theories. We cannot exactly, say that this is completely proven. These are some theories based on some scientist, opinions. So first we have the vascular theory. So what does that say? Intracranial vasoconstriction leads to ischemia, leads to migraine aura, leads to rebound vasodilation. That causes the activation of perivascular nociceptive nerves, which leads to headache. Intracranial vasoconstriction. Intra means inside, cranial means inside your brain. Vasoconstriction. So this usually happens if you are suffering from stroke or any kind of blood supply is blocked in the brain. So that leads to ischemia. Ischemia, you know the meaning very well, lack of proper blood supply. That leads to migraine aura. I'll talk about aura later. That causes vasodilation. And that activates certain kind of nerves in the brain, which is known as nociceptive nerves, perivascular nociceptive nerves. Nociception means, always remember, wherever you hear the word nociception, somewhere or the other it is related to pain. So that can cause headache. So you can, connect a practical knowledge with it. If you are taking any medicine that causes cerebral ischemia or increases the risk of stroke, or if you are a person who is already suffering from ischemic stroke, then headache or migraine may also be triggered along with it, or maybe later. Now we come to neurovascular theory, which is almost the same as that of vascular theory. So that is actually, there's a slight difference only. Combination of neural and vascular event causes migraine headache. So for example, if there is any damage in your neurons, or if you're suffering from seizures or something like that, or any kind of damage to your brain, and if it is coupled with vascular events, which is already mentioned in the vascular theory, that can trigger migraine headache. So this is associated also with changes in cerebral perfusion. Perfusion means the supply of blood. So obviously, if lack of blood supply in the brain occurs, that can cause damage to the tissue, and definitely it can activate the nociceptive nerves, which leads to migraine headaches. Cortical spreading depression theory, CSD. So CSD is a wave of neuronal excitation in the cortical gray matter. So cortex, you know very well. So cellular depolarization in the gray matter causes aura phase. The trigeminal fibers get activated, which can cause headache. Trigeminal, you know very well. Anyways, I'll be talking about neuralgias in future. So there is a very notorious kind of neuralgia, which is known as trigeminal neuralgia. So if you have heard of this term, you know very well how dangerous and how horrible that disease is. So if there is a depolarization in the gray matter, we have a gray matter and the white matter. You can refer in, the anatomy and physiology of CNS, you will understand what it is. If there is a depolarization in the gray matter, that causes aura phase, and that activates the trigeminal nerve fibers. And wherever you hear the word trigeminal nerve, somewhere or the other, if that gets activated or damaged, it usually causes very severe pain. So that can also cause headache. Then we have vasoactive substances and neurotransmitters theory. So if there is an activation of the perivascular nerve fibers, so that causes the release of substance P, neurokinin A, and nitric oxide. So vasodilation occurs, which activates the trigeminocervical complex, which causes headache. So these are actually, what this theory speaks is, there are some neurotransmitters and there are some vasoactive substances. If they are involved, they can also cause headache. So if the perivascular nerve is activated, it releases three kinds of substances. Number one is substance P. You will remember substance P is associated with pain. If you read pain pathways, you will find this molecule there. And that is why if you are dealing with orthopedic departments, or if you have heard of the molecule capsaicin, it is available in cream formulation. The mechanism of that cream is actually to inhibit substance P and reduce pain. Actually, capsaicin is used in osteoarthritis. So if you refer the management of osteoarthritis, you will find it there. Then we have neurokinin A, and then we have NO. NO means nitric oxide. So remember, nitric oxide can cause headache. So what is the practical knowledge that you can derive from this? If you remember any medicine that releases nitric oxide, they can cause headache as a side effect. For example, nitrates, which are used in angina pectoris. If you look at the side effect of nitrates, you will find throbbing headache because they release the substance nitric oxide. Another interesting thing that I want to tell you is, if there is vasoconstriction in the brain, that can also cause headache. If there is vasodilation in the brain, that can also cause headache. So that is why the treatment of migraine headache is very, very tough. Because if you are using a vasoconstrictor, that can also trigger headache sometime or the other. Means, for example, you are having vasodilation in your brain and you are using a vasoconstrictor, that can trigger headache due to vasoconstriction. If you are having vasoconstriction and you are using a vasodilator, that can also trigger headache due to vasodilation in the long term. That is why the treatment of migraine headache is pharmacotherapeutic, but we need lots of non-pharmacotherapeutic measures as well. Only then the treatment strategy actually makes any meaning. So that is why, if you remember the mechanism of action of nitrates, nitroglycerin, isosorbate dinitrate, pentaerythritol tetranitrate, and all those things, you will remember that they release a molecule known as nitric oxide, which is a very powerful vasodilator. And that is why the side effect is headache. Now we come to dopamine theory. If dopamine is activated, that can also cause migraine symptoms, or it can also cause headache. So from this also you can derive another practical knowledge. If anti-Parkinsonian drugs are used in a Parkinsonian patient, headache might be seen, especially in dopamine precursors. Because according to the dopamine theory, dopamine activation causes migraine symptoms. So if you are using levodopa carbidopa combination, anyways, you know that Parkinson's disease is almost incurable. So obviously levodopa carbidopa will go on for a very long time. So they actually increase the level of dopamine in the CNS. So that can actually cause migraine symptoms. So it can cause, always remember, if dopamine is overactivated, I have told you a lot of things which happens. It can cause, sexual hyperactivity. It can cause gambling tendency. If dopamine is overactivated, for example, in normal doses, dopamine causes hypotension. and in higher doses, dopamine causes hypertension. If dopamine is overactivated, it can usually cause nausea, vomiting, because that is why we use anti-dopaminergic agents like metoclopramide, domperidone. If dopamine is too much activated, it can cause yawning. So that is very commonly seen in patients who are on dopaminergic agents. And definitely if dopamine is activated, it can cause hyperactivity. That is why people who take, CNS stimulants and then they, go for parties or pubs or something, you will find that they will, keep on dancing uncontrollably and they will not get tired also, because dopamine makes you seriously active. So dopamine also has a role to play in migraine symptoms. If we look at the clinical presentation of migraine, we can have recurring episodes of throbbing headaches. Throbbing means is like, somebody is taking a small hammer and beating on the side of your head repeatedly. So that kind of notorious headache is called throbbing headache. Then definitely nausea and vomiting due to dopamine overactivation, sensitivity to sound and sensitivity to light. So this thing is very commonly seen. So that is why this kind of people are always advised, if they are suffering from severe migraine, their relatives or people who are staying with them are usually advised that, they should not be put or they should not be kept in any kind of rooms where there is multiple lighting system, or any kind of room where there is too much of music being played or any kind of speaker is being played. This kind of people will get irritated very easily because of migraine headache. Definitely difficulty in concentrating. So this is a very common sense. If you are having headache, how will you have concentration in anything that you do, whether it is study, whether it is doing your job or whatever it is. If you look at the psychological symptoms, yes, if I am having an headache, I'll be the most irritated person available. That can cause depression, because in the long term, especially if I am taking medications for a long time, I will also feel depressed, because I know that my work life or study life balance is getting distorted due to this disease. I'm not able to work properly. My productivity is reducing. So that can land me in depression as well. It can cause anxiety also, because as I said, depression leads to anxiety. If you find that your day is not productive, you're not able to do anything, then definitely you will have a fear that the next day also the same thing may happen. So this is also another problem. It will cause restlessness, especially if there is dopamine hyperactivity. It will make you very restless. And if you are having headache, definitely, if anybody has had headache in their life, or if you who is listening to this, if you had headache, you can understand very well how restless you will be. You will want to get that pain over as soon as possible. Maybe if there is a button which you can press and that headache goes, you will feel very happy. So restlessness will be there, irritation, agitation, all these things will be there. And hyperactivity. So hyperactivity can be a part of agitation, or hyperactivity can be a part of dopamine involvement. You can have yawning. So yawning is usually seen, I said, as a part of dopamine hyperactivity. Anorexia, because obviously if you are having very severe headache, you will not feel like eating anything. And definitely migraine headache has a role to play on your autonomic nervous system as well. So that can cause anorexia and constipation. In most of the conditions, it has also been seen due to the effect on the hypothalamus as well. There are conditions where people get increased urination due to migraine headaches. So polyuria has been seen. And definitely you know what happens if you are having polyuria, you will have increased thirst. So it is called polydipsia. You will have increased thirst. This is actually seen with diabetes also, because urination will be very high. So they will always be very thirsty. Migraine attacks, severe migraine attacks usually occur in the early morning hours after you get up from sleep. So it will be very, very horrific. If it is not treated properly, it may last for 4 to 72 hours as well. But usually it doesn't happen. I can't imagine a person who is having headache for 4 hours continuously, leave alone 72 hours. That is unimaginable. But there are some conditions in which you may get moderate intensity or mild to moderate intensity headache. And another thing is what I want to say is it's not necessary that it may occur in the early morning hours. Maybe, for example, you're walking in the heat and coming back, you may get a headache because of that. So it's always not time dependent. It is flexible. Anytime you may get a headache. So this is actually the timeline of a migraine attack. We have four kinds of stages. One is called the prodromal stage. The other is called the oral stage. Then we have the proper headache stage. And then we have the post-drome stage. Prodrome stage usually is few hours to days. So before a migraine attack actually comes, we have a prodromal stage. So you will have irritability, depression, yawning, increased need to urinate. You will have craving for particular kind of food, problems in concentrating, sensitivity to light and sound, etc., etc. Then we have an aura phase. Aura phase actually stays for 5 to 60 minutes. We have visual disturbances. So means, suddenly you will get temporary loss of sight. You may have blurred vision. And in very severe cases, I'll show you the pictures later. In that condition, what happens is one side of your eye, the vision will be gone. Then we come to the proper headache, which comes within 4 to 72 hours, which lasts for 4 to 72 hours. We have throbbing headache. We feel like somebody is using a drilling machine on the side of our head. That painful it may be. Or maybe using an ice pick in the head. Ice pick is actually a material which is used to cut ice. So just imagine if you are cutting ice, how sharp that thing will be. If that is pricking your head, then I don't need to explain. Burning tendency, nausea, vomiting, giddiness, all these things will happen. Then we have a post-dromal stage, which is for 24 to 48 hours. You will be completely depressed. Maybe you may have an euphoric mood also, maybe because the migraine headache resolved. But mostly we usually are completely tired and exhausted and depressed, because if you see most of the patients who are suffering from migraine, they usually take a paracetamol 650 or 1 gram, or maybe they may be taking a naproxen tablet or aceclofenac tablet. Once they take it and the headache reduces, they only feel to do one thing, and that is to sleep. Because that is a kind of post-dromal stage where they are completely relaxed, that they are relieved and they are thanking the Almighty that the headache has reduced. Now the only thing that they want is a sound sleep. So these are the different oral symptoms that we can see in migraine headaches. One is called scintillation scotoma. So this is, as you can see in the image, blind spots that flicker between light and dark. So if you look at this image, you can understand that this is not a normal vision. In normal vision, we will never have an image like this. So there are various areas where it is blurred, and the light and dark images we are not able to differentiate properly. So this is called scintillation scotoma. Then we have photopsia. So this is perceived flashes of light in the field of vision. So you can see that this is a dark image and a sudden flash of light is going. So this kind of flashes you will see in front of you. So this is also an oral symptom of migraine, which is known as photopsia. Then we have hemianopia. So loss of vision or blindness on one side of the eye. Remember, one side of the eye, not one eye. So this is also extremely notorious, because once one complete, if there is no vision on complete one eye, it is still okay. But if you have loss of vision or blindness on one side of the eye and it happens on both the eyes, you will literally not be able to interpret anything, as you can see in the image below. And the other oral symptoms are paresthesias. You can have numbness, or you can have, some kind of unexplained burning sensation or pain. And aphasia. Aphasia means slurred speech, difficulty in talking or slurred speech. How to diagnose migraine? That is, we don't need to actually understand whether a patient is suffering from headache or not. Whether it is any population in this world, they'll go to a clinic or a hospital and say that they are having pain in the head, at least in simple terms. So that is a very easy diagnosis. But we still don't know why this happened. So we have to look at the trigger factors, or we have to look at the risk factors or the precipitating factors. So comprehensive headache history evaluation, onset of headache. When did this headache happen? What were the triggers? So we will ask them whether what was the dinner you had, or what was the recent food you had. Are you alcoholic, or are you, a smoker or something? But do you take any other drugs? We can also ask them some other things like, for example, are you taking any medications? For example, vasodilators can trigger headache, vasoconstrictors can trigger headache, or there are so many other medications which actually cause headache as a side effect. Age oriented also, because with increasing age, there are deformations in the brain, the brain becomes weaker and weaker. So that can also lead to headache. Where are there any other secondary factors? So secondary factors can be many things. As I said, it depends on your food habits and all these things also, because there are food triggers as well. Then we can analyze neurological abnormalities. For example, is there any problem in the mental status? Like, for example, the patient is suffering from any kind of maybe anxiety or depression, which can trigger this. Are there any damage to the cranial nerves? As I said, trigeminal nerve or any other cranial nerve, if there is a damage, that may trigger headache. We can analyze the vital signs also, the temperature of the patient and the BP, because if the BP is very low or the BP is very high, then also headache may happen due to vasodilation or vasoconstriction respectively. There are certain laboratory tests that we can do. We can perform a CT scan to find out whether there are any other brain damage or damages which is actually precipitating this. We can go for an MRI, which gives a better view. We can also look at thyroid function tests, because hyperthyroidism can also trigger headaches. We can look at CBC and ESR. So those are actually, just very basic tests. So that actually help to find whether we have any infection or any inflammation in the body. ESR can also reveal some kind of autoimmune conditions or inflammation that can also trigger headache. So that's it for this presentation. As I said, I'll talk till diagnosis. Tomorrow, I'll come back with the next video, part 2. In that, I'll talk about the goals of therapy, what are the different guidelines, and we will also talk about some part of the pharmacotherapy. And as I said, this presentation is going to be extremely long because there are so many medications that I'll be mentioning in this. And there are so many interesting things about this medications, that is practical knowledge. So definitely I may, deviate a bit, but still I can promise you that you will definitely get loads of information to note down. So I hope I have been of service to you. I hope this presentation till now has been worth your time. And if you have any suggestions, if you have any queries, if you want this presentation, please contact me in LinkedIn and I'll be happy to share the same to you. It is a big presentation, so if you have any queries, you can contact me there as well. So that's it for today. Thank you so much for listening to me. Until then, it's goodbye.